My name is Dylan Crail, and I'm a student PTA at CBD College. My patient is a 55-year-old who presents with early stages of degenerative disc disease within the lumbar spine. Based on the information given about her case and regarding her impairments and limitations, I've come to the conclusion that her lumbar treatment-based classification category falls within the subacute phase. My conclusion is based on the following. Her Oswestry score, first off, is a 12, which would actually imply a chronic phase in its own standing, as subacute phase falls within about 15 to 30. However, the rest of her information is what's concerning and what would actually imply that she is subacute. For example, sitting 25 to 30 minutes, she begins to feel an 8 out of 10 pain within her lumbar spine, and just going anywhere to 30 minutes or less without tolerance of being able to sit would imply actually the acute phase. So the fact that she is starting to feel pain, almost intolerable pain, at about the 30-minute mark, 25 to 30-minute mark, that would imply that she is actually just exiting the acute phase as far as sitting. Standing, anyone in the acute phase cannot stand for 15 minutes, maybe even less, and she begins to feel stiffness after the 10-minute mark. So that would also imply that she's probably just going to be able to stand for just over 15 minutes if she's already starting to feel stiffness within 10. She also cannot run, and she has problems getting out of bed as well as walking. She feels a lot of discomfort in just those types of instrumental activities of daily living, which would also further imply the subacute phase. Based on our key findings for this patient, I have found 3 exercises that I would implement that would help her mobility and strengthen her core over time and progress with her recovery. And they are as followed. Our patient presents with weak flexors, or rather tight flexors, that we are trying to extend. We are trying to gain range of motion. And we are also trying to strengthen the core, as this is a very hallmark type of thing that we're trying to improve during the subacute phase. So a good workout we can do to help isolate all of those things would be a planking position. We can start out on our knees and our elbows. And as our patient begins to gain more strength, we can get her off her knees and onto her toes. And this is a good way to isolate that core and strengthen it. And then we can begin doing some straight leg raises, as that would improve the extensors and gain range of motion in our flexors as well. Another issue with our patient revolves her lordotic posture. And she seems to present with an anterior tilt of the pelvis because she has very tight flexors, and we need to lengthen those. And we need to strengthen her abdominals as well, because that is showing a 4 out of 5 in her MMT. So another good workout to do would actually involve pulleys. Just imagine I have some pulleys here with them being tied back here. Kind of just pull them over your shoulder. First, you want to tilt your pelvis posteriorly as much as you can, and we do this by kind of flexing our hips right here. Put our hips forward and flex our glutes, and we would then use our abdominal muscles to pull the resistance downward. And this would be flexing our trunk, and while keeping our pelvis forward as much as we can, we would be posteriorly tilting it. We would be strengthening our extensors at the same time our abdominals, while gaining that, actually kind of stretching them flexors out as well. Another key finding about our patient is the fact that she has issues with side bending to her right. when she does that, there's a catching feeling. And we want to try to eliminate that as much as we can and gain her ability to go into that motion as much as possible, as normally as possible. So we can do that through side bending exercises, such as this one, where we would be on the bed, try to find ourselves on an edge of a bed somewhere, or any type of surface, some flat surface, where we would have our torso kind of just hanging off the side, obviously with some padding, and then we can just do side bends towards the affected side. And we can start with our arms on our side while putting our right arm just kind of sliding down our leg as we go this way. And once she gains more strength, we can actually put her hands behind her head and do the same motions. That would add more resistance as there's more weight towards this area and therefore more for her trunk to pull. And we can progress to that as she gets better.